sent these out. They're all here. How are you?
You mean they're just out walking around?
Yeah. Can we?
They just don't want to work. Ready?
I guess.
Yeah. Hold on.
Okay. All right. Let's get going. Good afternoon. Today is September 3rd, 2025, and it is 5:05 p.m. As a quorum of the committee is in attendance, I would like to call to order the meeting of the Central Health Medical Committee. As a reminder, one of our committee members may also participate in a video conference, so the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. The first item of business is public communication. I'd like to announce that in order to make it more accessible to committee members, we will hold public communications for both the medical committee and the board of management at 6 p.m. unless a member of the public wishes to comment on a specific item on this agenda. Do you have any comments? No? Okay. We will now proceed to the committee agenda. Members, we're taking items 1 and 3. I'm sorry. We will now proceed to the committee agenda. Members will be taking items 1 and 3 first, and then taking items 2 and 4 in closed session. Agenda number 1, approve the minutes of the August 23rd, 2023 Medical Committee meeting. Do I have a motion? I have a motion and a second from Manager Kitchen. All in favor? Any opposed? Any abstaining? The motion passes. Number 3, committee agenda is receive and discuss a presentation on the Medical Executive Committee Board Committee structure. Dr. Alan Salsha and Monica Crowley will be presenting. Oh, there she is. Good. Okay, there'll be no motion necessary in this item. It's informational. Thank you, Alan, for coming.
All right. Good afternoon, Dr. Martin and managers. Thank you for having us. We're really excited to share some information with you. My gifted colleague, Monica Crowley, is gonna begin, and I'm gonna pick up after she starts off. Monica?
And thank you. Dr. Shalsha, do we have a presentation that is, thanks so much.
Can we go to the next slide, please? And one more.
Thank you, Dr. Shalsha and Valerie. So under Texas law and under Chapter 281, in Texas, the governance of and practice of medicine needs to be governed by physicians. And this applies for hospital districts as well as for private organizations. Under Chapter 281 of the Texas Health and Safety Code, which is Central Health's founding legislation and our key governing piece of legislation, Central Health has been able to employ physicians and dentists to provide services through community care and in the role of a medical director for Central Health since Central Health's creation. In 2019, the legislature at Central Health's request amended Chapter 281 to allow Central Health to appoint, contract for, and employ physicians as the Board of Managers considers necessary for the efficient operation of the district. Also, Chapter 281 was amended to require a medical executive board be created for Central Health to ensure that any doctors that are employed by Central Health are allowed to exercise their independent medical judgment in providing care to patients. And it also ensures that the Board of Managers is prohibited from supervising or controlling the practice of medicine. And at this point, there was a medical executive board that was created by the Central Health Board of Managers. Next slide, please. And so I'm going to start the framework piece talking about how the Central Health Board of Managers adopted a resolution to establish a medical executive board. The Central Health Board of Managers appointed the initial officers of the Central Health Medical Executive Board. The Board of Managers also directed the Medical Executive Board, or MEB, to develop policies for the operation of the Medical Executive Board. The Central Health Board of Managers also retains the ability to develop the strategic plans for Central Health, and is available through its medical committee to hear and facilitate resolution of conflicts that may arise related to the Medical Executive Board. And then, of course, the Central Health Board of Managers, even with the Medical Executive Board, the Central Health Board of Managers retains all of its budgeting authority and oversight, and determines both what to fund, what services to fund, and what level of funding to provide. The Medical Executive Board has no control of funding by Central Health. It does oversee the practice of medicine, and I am going to hand the presentation back to Dr. Shasha at this point.
Thanks so much, Monica. I'm going to run through the structure of the various committees, and I'm going to run through them pretty quickly. I think we've got a little less than an hour, and we've got a couple other agenda items, I think, in closed session. So in order to be able to get to, I think, those significant items, I'm going to get through. There are various committees.
Excuse me, Dr. Shasha, if I'd like to ask the board to hold off on questions till the very end, we have a lot to cover. Thank you.
All right, thank you, sir. There are various committees. On the next slide, we'll show the structure. All of these committees, thank you. All of these committees report up to the Medical Executive Board. The committees themselves make recommendations, and then the Medical Executive Board adopts those recommendations, augments those recommendations, or actually denies those recommendations. This governs the direct practice of medicine, and also weighs into kind of the network practice of medicine. And one example of that may be credentialing. Next slide, please. Within each committee, physicians directly employed by Central Health sit as voting members, though, as you can see with our credentialing committee, we have multiple subject matter experts and stakeholders who sit within the committee and offer their expertise. Our credentialing committee obviously assures that individuals who see our patients are in good standing with the board, or either board certified or board eligible. And this is for both our direct practice and kind of our network practice. This committee meets on a monthly basis. Next slide, please. Pharmacy and therapeutics. This is for maintenance of our formulary for the direct practice of medicine. So addition or removal of medications. Also, we look at the cost effectiveness. So the business of medicine really is considered in this environment as we, as we maintain, or we are good stewards of tax dollars. We do have some external partners who sit within this committee, as their patients may be referred to specialty within our environment, and so they can share their thoughts as related to medications that we add or remove to our formulary. This committee meets on a bi-monthly basis. Next slide, please. Thanks. So this is where we kind of govern the quality of medicine. Presentations, there are going to be a couple of presentations that you all will hear a little bit later. These presentations can get pretty detailed, close to touching on either direct patient information or touching on metrics for some of our contracted partners. But this is where you can see the membership to this committee is much more broad. Our Quality and Improvement Committee that meets on a monthly basis is not just a report out committee. It's a committee where we ask hard questions, and the goal is actually for continual process improvement. And so that's why I think having, a significant stakeholder base really makes that a much more beefy and functional committee. Next slide, please. Policies, Protocols, and Procedures Committee. It's really the policies that are openly debated here, and recommendations then go to the Medical Executive Board. Procedures and protocols do not have to be voted on by the MEB, but since we bring kind of this unique stakeholder group together, a lot of times it is very functional to discuss both the procedures and the protocols, and those then move much more fluidly through the process. Next slide, please. Peer review. This committee, as do our Safety and Infection Control Committee, report up to our Quality Committee. Peer review really speaks to the governance and the quality of direct patient care. So this is where chart audits for our providers are seen. If there is a question as to provider practice, this is the environment that the team does its due diligence. If let's say there is an investigation that is undertaken, and the investigation is found that it's not person specific but process specific, a root cause analysis is then born, and that root cause analysis then is discussed and presented within our Quality Committee. The Peer Review Committee, if there are provider opportunities that are found, can recommend additional medical education. They can recommend, they can suspend the provider. There are board citations that can, be undertaken. But the majority of, what tends to occur and what we tend to find is that it really is process dependent, that there are opportunities to improve how we do things within the system. Next slide, please. Medical Executive Board. Again, all committees report up to our Medical Executive Board. So on a monthly basis, we will review everything from credentialing to policies, procedures, and protocols, and then any quality recommendations, and those are voted on by our Medical Executive Board. So lots of meetings that occur on a monthly basis, but really helps us govern the practice of medicine. And Dr. Martin, I think next slide. I think I had questions up here, but we'll hold those questions off till. All right.
Are we ready to go into closed session? Okay. At this time, I'm going to go announce that the committee is convening in closed session to discuss agenda items 2 and 4 in accordance with Health and Safety Code Section 161.302B as defined by the Texas Occupation Code Section 151-002 and under Texas Government Code 551071. Consultation with attorney. The item number 1 will be receive and discuss a presentation on hepatitis C treatments and cures. Agenda item 4 will be receive and discuss a presentation on the structure, process, and future planning for utilization reviews within specialty care environments. At this. Okay. It is still September 3rd, 2025, and it's 5:20 p.m. ready? Oh, do you have a quorum? Okay. At this time, I'd like to announce that we are coming into open session. I know, wait, yeah. Hang on. I banged it pretty hard. Just wait a second. Okay. At this time, I'd like to announce we're, and
Quiet, please,
attention,
everyone.
please. Thank you. We need to move on. I'm gonna get violent. Okay, thank you. There's a lot of people coming in, so hang on. That's okay. We've noted it. At this time, I'd like to announce we're entering to open session. It's September 3rd, 2025. It is 6:19 p.m. I'd like to, our next agenda items, confirm the next medical committee meeting, date, time, and location. Manager, we do not currently have a scheduled central health committee meeting. When a need for a meeting arises, we will work with committee members and other managers to choose a date and time that works for everyone's schedule. At this time, I'm ready to accept a motion for adjournment. Manager Maloney, and second by Dr. Brinson. In favor? Aye. All opposed? Any opposed? Okay, nay. So, the motion moves. Thank you. We're adjourned.
Good evening. Today is September 3rd, and it is 6:19. As a quorum of the board is in attendance, I'd like to call to order the meeting of the Central Health Board of Managers. We'll now proceed to the public hearing. Everyone, this evening's hearing is the official public hearing required by the Texas Tax Code, which we announced in our previous meeting on Wednesday, August 27th, 2025. Notice of this evening's public hearing was published in the Austin American-Statesman, was posted on the main page of the Central Health website, and has been broadcast on Travis County Television. The hearing will begin with staff's presentation of the budget and proposed tax rate. At the conclusion of the presentation, we will invite comments from the public. To make comments during the public hearing, members of the public must either be physically present at Central Health or have registered with Central Health via the online form or by telephone no later than 4:30 p.m. today. So we're going to go to the presentation, which is Nikki Riley and Jeff Canodal will be presenting. They'll present an overview of the proposed Central Health fiscal year 2026 budget and its associated tax rate.
Good evening, thank you. Nikki Riley, Deputy Chief Financial Officer. I'm going to quickly go over the rate and the budget and some information about where they can see the budget online very quickly so we can start the hearing. We are proposing an 8% over the no new revenue rate tax increase. Maintenance and operations tax rate then will be 11.3569 cents per $100 of value. Debt service tax rate will be 0.4454 cents and per $100 of value, making it a total tax rate of 11.8023 cents per $100 value. This increases taxes on the average homestead of $64. The next slide is the budget that is generated from that tax increase. It shows all available resources will be $875 million, and then uses with the ending balance, $875 million. On the next slide, the budget adoption timeline. The hearing is today, September 10th. We will come back and the board will take action on the budget. And then September 16th, we go to the Travis County Commissioners Court and they will vote and take action on the budget as well and tax rate. On the next two slides is some information about where you can find the budget on our website. And so I can give out that information if that's not legible.
Yeah, if you could give it out, that'd be
Yeah.
great.
and that's it.
Can you just speak it for people?
Oh, yeah.
Yeah.
So you can go to Central Health, the proposed budget is at centralhealth.net. And it's on the finance tab. And it's right on the front of that website. You can easily see it. Then proposed tax rate in Travis County, for all Travis County entities is on the, travis.trueprodigy, tax transparency website. And then Central Health Board of Managers meetings, it has all the agenda items on the past budgets that we have presented. We presented this very budget last week, so you can see that as well. And then Travis County Commissioners Court meetings, we have not presented a budget there, but we will on the 16th, and they'll be able to see it there.
Thank you, and for the members of the public, as you said, this budget was presented in more detail at our meeting last week, and people can go online and they can watch it and listen to it. So we're going to proceed to the public hearing right now. Do you have a question about process?
Yes, actually about the information. I was hoping, Nikki, that y'all could, if Madam Chair, if you don't mind, that they put the budget and tax rate on the front of the page
Okay.
without anybody
Thank
having to
you.
go search for finance.
Thank you.
Just right there.
Thank you, Manager Valdez. That's an important request on our website. So, okay. We're now going to proceed to receive public comment on the proposed Central Health fiscal year 2026 budget and its associated tax rate. Yesenia Ramos of the Central Health Communication Department will briefly cover the guidelines for the public hearing portion of the meeting and will then call upon members of the public to comment. Once you've been recognized, please approach the podium if you are physically present, right there. Or if you're attending virtually, a member of staff will unmute your microphone and invite you to turn on your video if you wish. Please begin your comments by stating your name. There's a 3-minute limit for comments per board rule. And members, I think we have about 15 people or so that are signed up for public comment tonight. So I'm going to turn it over to Yesenia Ramos.
Thank you, Chair Kitchen. Can y'all hear me?
Yes, we can hear you.
Okay, perfect. I'm going to call Dominique Holman with the Black Men's Health Clinic, who is joining us online.
Good evening, everyone. My name is Dominique Holman. I want to take a moment to thank Central Health for believing in the funding for BMH, Black Men's Health Clinic this far. Most of the time, all it takes is a few people willing to believe. And at the very beginning, you believed in an organization that started with one man's vision. Here we are. A few years later, the Black Men's Health Clinic has restored help in the eyes of men throughout the community, serving as a listening ear and a voice of reason for so many. As we continue to grow, we are asking for an increase in funding to expand our reach and serve even more individuals. We work with a community that carries deep hurt, and yet they are choosing to lean on us and trust us with their lives. With additional support, we can extend our impact and walk alongside even more men on their journey to health, healing, and wholeness. Thank you.
Thank you.
Thank you, Dominique. Up next, we have Kara Hanoka with Good Work Austin, who's joining us in person. Thank you, Kara. You have 3 minutes.
Thank you.
Awesome. Good evening, and thanks for having me tonight. I'm Kara Hanoka. I'm the Executive Director of Good Work Austin. We're the only nonprofit in Central Texas that fights for better jobs and fair treatment for food workers. I know that you met a lot of our business owners at the last meeting, and I just want to thank you so much for hearing their stories and their experiences and having a really rich discussion about how can we better serve our food workers. I just want to start with kind of responding to some of that discussion. One is that health equity is a huge importance for our community, and I know for Central Health. And so food workers, I think, are a big part of that. When we think about segmenting out populations, of course, the mandate is to serve everyone experiencing poverty and reaching those most vulnerable. And food workers are a part of that population. A little bit about me. I've been doing this work for about 15 years in the community, working in food access and nutrition. And I used to be in charge of expanding food distribution for the Central Texas Food Bank. And what I can tell you, what I learned in that role over 5 years, is that we are missing many community members when we don't think about health equity. When we don't think about their needs and specific experiences, like our food workers, we miss people. And so the food bank went from pouring food into the community to thinking about, can we go to health clinics? Can we set up food pantries at schools? To now medically tailored meals, which Central Health supports. Because we need to create specialized resources for different communities. That is the concept of health equity, and I know that y'all are a big part of achieving that vision. So when we think about food workers, they're another part of that segmented strategy. It doesn't mean that you're skipping the mandate to serve everyone in Austin, but as Chair Kitchen mentioned, it's a strategy for reaching people that we're missing. Food workers are our lowest paid occupational group in the city and have some of the highest uninsured rates. We're missing them. And so that's why those business owners came to share those stories. The other part is that, unfortunately, 3 minutes isn't enough to tell you how complex the hospitality industry is and why business owners aren't able to provide health insurance. It's not because they're wealthy. It's not because they're holding back those services. It's because that system was built on institutional racism. $2.13 an hour has not changed, and that is intentional. That system was designed intentionally, and these business owners that came before you want to change that system, but they can't hire prices on their menus. They'll close down. It's a bigger, more complex issue, which is why Good Work Austin and our business owners want to work with Central Health. The staff at Central Health has been amazing in sharing MAP resources with us. Perla's been great about what can we do in the future. And really, this is an extension of, we want to work with Central Health. We want to do a feasibility study to better understand the complexities of what's going on. And I really look forward to continuing to work with you all. Thanks.
Thank you.
Thank you, Kara. Up next, virtually, we have Josh, Lavon Williams with the Black Men's Health Clinic. And after Lavon, in person, we'll have Paul Scott with HAM.
Thank you so very much for this opportunity. First, I want to thank you, Central Texas, for what you do, but not just Black Men Health Clinic, because Black Men Health Clinic taught me that all the nonprofits that are in Austin, Texas, we are a village. It's more powerful in the we than in just the division of the you. And right now, you know, we are your laymen's. We go out there, we find out, we see them, we listen to them. We're out there in the fields. We do what we do while y'all do what y'all do, and we appreciate everything y'all do. We go out there with humility. I cry every night I come home, but you know what? I feel so good to know that I'm not doing anything. I'm more than just a voice. I am out there in the field, committing my very life. The same opportunity that Black Men Health Clinic gave me. I've been there. I've been all in the dark places, but it's because of the nonprofit organizations such as Black Men Health Clinic that held my hand and walked with me, not for me. They took me to the water, but I had to drink. They put the plate in front of me, but I had to eat. And now they're educating me in so many areas that we need. And what we do is we help y'all like y'all help us. We die down the diversity. It may never be over, but just to let them people know that somebody is there for them, love them, care about them, and look at them as people and not animals or things. I can never thank y'all enough. And I tip my hat to Black Men Health Clinic and all the other nonprofit organizations that I've had the opportunity to connect with, to meet. And we are so powerful out there together. Thank you so much.
Thank you, Levon. Paul Scott with Ham.
Good evening. I appreciate the opportunity to speak today about HAM and about Central Health, and in the first few minutes hearing the collective impact of what y'all are doing in the community for health of our Travis County residents, as well as the health equity focus is incredible. I'm Paul Scott. I'm the CEO at HAM, Health Alliance for Austin Musicians. And I'm here on behalf of our 3,000 musician members. And we want to thank you for our continued partnership that we have with Central Health over the years. We thank you for advancing health equity in Travis County and what that means for our community and changing the impact of health and those outcomes. Our partnership is strategic in affording comprehensive health care for low-income musicians and their families, and it's even more critical with the recent changes to the ACA, which threaten the affordability and stability for many in our community. And this partnership is incredibly important to making sure that we can provide access to comprehensive care. And because of this partnership, we serve nearly 1,400 Austin musicians through our partnership with Central Health, with over access to 1,200 Sendero plans. This includes not only musicians, but also their families. These are working artists, many with extremely limited incomes, which now have affordable and comprehensive coverage. The Premium Assistance Program and Sendero means that our musicians are not only insured, but they're actively using preventative, primary, and specialty care that keeps them healthy and ability to keep making music in the community. And we see in our data that our musicians, the longer they're in comprehensive health care, the more likely they're going to be getting preventative health care visits, which means they're more likely not to have more advanced medical conditions. And this equity lens that we apply along with Central Health means that we continue to reach out to the diverse musicians and community members. Over the last decade, we've seen dramatic growth in our racial and ethnic diversity, women and non-binary musicians, and LGBTQ representation as well. With Central Health's support, these artists and their families are not left behind, and they are fully included in our healthcare system. The value of this is really critical in terms of how we're leveraging the federal advanced premium tax credits. We're bringing these outside dollars in our community to support healthcare in our community. Every federal dollar we capture reduces a local cost, saving our Travis County taxpayers, property owners like me, millions of dollars that would otherwise go to uncompensated care. This ensures that our federal tax dollars stay here in Travis County, supporting our local providers and our safety net system, of which Central Health is so integral in providing. So Central Health's vision of connected system of care is realized through this partnership with HAM. It's equity-focused access, comprehensive coverage, and removal of financial barriers. Together, we show that the safety net institutions and nonprofits aligned and can create universal access for many in our community. So thank you for your leadership, your advocacy, and your trust, and your innovation as well in terms of providing health care. And we're pleased at HAM to be able to partner with Central Health, and thank you for your intentionality to this budget and your outreach to our low-income residents of Travis County. Thank you.
Thank you, Paul. Up next, we have Mr. Larry Wallace Sr., and after will be Dr. Larry Wallace Jr. with the Black Men's Health Clinic.
Good evening. Is this on? Are we good? Okay. My name is Larry Wallace, Sr. I'm the founder and CEO for the Black Men's Health Clinic. And we're thrilled to be a partner with Central Health. And we do our work because we make a difference in the lives of men. We align with your health equity plan and the commitment that you've made to the community to increase access to care. You take that seriously, and so do we. The Black Men's Health Clinic was really created to reach those men that are not actively seeking care. we have clinics, we have places where people can go, but certain segments of the population will not do it. And so we are really equipped through our navigation, outreach programs, and our care management to bring men into care. We're blessed to have a partner like Community Care. We couldn't do this without Community Care, because what makes us different than other outreach organizations, we can actually make an appointment directly into the clinic. And regardless of where we're at, and because of our relationship with Community Care, that really makes us unique. And so I just want to say thank you. Thank you for supporting us where we can expand our services. Last time I was here, I told you I was concerned about wait times for appointments. And what we promised men was to try to have a system where you don't have to wait 3 or 4 months to see a doctor. Men are not going to wait. And so we're just wired that way. And so to be able to get them in within a timely manner, and I know that's the goal for Community Care as well as Central Health, and we line up with that. So to have another provider at our clinic, we'll be able to expand our hours. We always wanted to do some evenings and some Saturdays. We'll test it. We don't want to waste resources, but we'll follow the lead of the men that we serve. So I just, again, want to say thank you. And we're asking for additional support to help us with our infrastructure, our technology needs, and that's not a part of the clinical support that you provided to us. Dr. Wallace will go into detail, so I'll close with that. Thank you very much.
Thank you, Mr. Wallace Sr. After Dr. Wallace Jr. will be Patricia Young Brown with Integral Care.
Good evening. Good evening, Chair and members of the board. I'm Dr. Larry Wallace Jr., co-founder of the Black Men's Health Clinic, and currently serve as the Senior Director of Operations upon relinquishing my role as the first board chair. I want to thank you for the opportunity to speak tonight and for the leadership Central Health has shown through its new health equity plan. We also acknowledge the leadership support of Community Care in this work. BMHC was built on a similar philosophy. Our coined model of care and care network represent a new approach in healthcare, especially in public health, one that bridges medical and non-medical gaps with a person-centered focus. In this sense, our work aligns directly with the direction Central Health and its enterprise are already moving toward: value-based care, population health, and intentional gap mitigation. In alignment with that shared vision, and with the gratitude for the medical increase you have already approved, we're respectfully requesting the following. An increase of $150,000 is added to BMHC's current service contract for capacity building, specifically technology and systems, organizational infrastructure, and community engagement capacity. Within the existing service contract allocation, raising the administrative personnel cap from 10 to 15%. An operationally necessary adjustment to ensure management, stability, and scalability of BMHC as part of the Central Health Equity Plan partnership, with also requesting a change to the reimbursement process, as the current approach ties up roughly $90,000 to $120,000 at any given time, limiting our ability to fully carry out our last resort and direct client assistance programs. Supports that step in when existing resources cannot meet the full need, ensuring patients are not left without care, and strengthening Central Health's enterprise services. We understand that this may be outside of Central Health's customary funding practices, but it fits squarely within the equity strategies Central Health has already adopted, strategies to directly mitigate gaps, strengthen coordination, and expand access in ways that traditional systems have struggled to achieve. In addition to our on-site work with the Downtown Community Court, the Sunrise Navigation Center, Housing Authority of Travis County, we're preparing to expand into the Austin Transitional Center, 3 integral care sites, and establish a permanent presence at Community First Village beginning in FY26. We're also in active conversations with the Central Health leadership about integrating our movement is medicine exercise classes and food for the soul cooking courses at community care clinics on the east side, programs that address social determinants of health alongside clinical care. We would also value the inclusion of BMHC's Payer Last Resort program as a defined funding line within the service agreement, ensuring it is formally supported by Central Health as a program that extends assistance where existing coverage ends and advances the shared objective of closing the 15-year life expectancy gap east of I-35. Looking forward, we are excited to bring a Black dentist, formerly a MAP provider, into our care network, and we are working now to have him reapproved as a MAP provider for FY26. This is in direct alignment with Central Health's emphasis on expanding culturally competent care. Thank you for your time, your leadership, and your continued commitment to equity.
Thank you, Dr. Wallace Jr. Patricia Young Brown with Integral Care. And after Patricia will be Mr. Michael Lofton with African American Youth Harvest Foundation.
Good evening. It's good to see you all. Thanks for allowing me the time to get in front of you for a few minutes. First of all, thank you for your partnership with Integral Care. That ever-growing and integrated partnership means so much to us. And with all the uncertainty that we're all facing, it's even more critical. There are changes happening that we know about and we're responding to, and we know there are more coming, and we can't possibly anticipate what those are going to be. But with our partnership and our ability to work together to understand how that impacts the community, I feel certain we can manage it to the best we can. In funding consideration, the funding request that you're giving consideration to tonight for Integral Care represents continued support for our delivery system to the community. We recognize that you have been generous in increasing that support over the years, and I think that's come as a recognition of the roles that we can play together to make sure we're meeting the behavioral health needs of the community. But that support, in particular tonight, is really helping us to address those challenges I just spoke of, those things that we know are coming, and also the things that we know we're going to have to respond to during the year. One of those issues facing us, just as it's facing you as employers, is the rising cost of living in Austin. We're all struggling with, it was mentioned earlier, how do we pay the people that do the good work, who are people out there every day, the lifeblood of our organizations providing care to individuals. The support that you're providing or considering tonight to provide to us will help us not only continue our service delivery, it'll help us address those compensation and benefit needs that are so important to keep our staff in place, to help them be successful in their positions, to be able to stay at Integral Care because they can afford to work at Integral Care and live in Austin. I want to just share a couple of highlights of what your funding is doing for us tonight, assuming that you pass our request. Our board voted last week to include a 4% increase for our salaried individuals, and that is a step that builds on increases we've made over the last several years to try to build up the salaries of our lowest paid employees. In recognition that that is our target employee group, that we're trying to lift them up, we are implementing that increase effective September 1, and the remainder of the employees will be receiving that effective increase in January. That helps us balance the budget for this year and recognizes that where the most immediate need is. In addition to that, there are a few other things that we're able to start new programs for our employees, things we haven't had before.
30 seconds.
An educational support program that allow us to fund up to $4,000 a year for educational opportunities for advancement and skill development. Also, our ability to contribute to our employees' health savings accounts, so less of those healthcare costs are coming out of their pockets. And a few other programs that just help us make the employee's life more sustainable in the difficult work that they do every day serving those most in need in our community. We recognize that our relationship and our partnership is integral to our ongoing stability, and we thank you deeply from the bottom of our hearts for that. Thank you to the leadership of all of you, to Dr. Lee and his team, and we hope that we have many more years ahead of us to continue to make things better. And thank you for your service to the community. We know that what you do is so vital. So appreciate the time. Thank you.
Thank you.
Thank you, Patricia. Up next, Mr. Michael Lofton with the African American Youth Harvest Foundation. And after Mr. Lofton will be Jeff Jackson.
Good evening, Central Health, board managers, board chair, Dr. Lee. I'm Michael Lofton, the founder and executive director for the African American Youth Harvest Foundation, as well as the Harvest Trauma Recovery Center. So I'm extremely pleased to be here today. You know, one of the main reasons I came here today was to echo the support for the Black Men's Health Clinic. I definitely support everything that Dr. Wallace has stated, that Mr. Wallace has stated, because I see them taking on a task, doing the service work that is much needed in our community. I don't know if you all know, I recently read an article that since January or February, over 330,000 Black women have lost employment, and it's even more for Black men. And what that says also is that there's going to be a number of other, individuals here. If you take a look at the Texas data, individuals that's needing health care that do not have access to health care. So I really want to thank you all for the support that you all are doing in supporting the Black Men's Health Clinic. In addition to that, I want to also call your attention to the African American Youth Resource Center that we have there. Definitely want to thank you all for participating in our back to school event that we had a few weeks ago. We had 1,200 to 1,500 individuals there, and you all were there, so really appreciate it. But one of the things that you would have saw there, that we had roughly about 35 to 40 different vendors there providing a wide array of healthcare services, and the community really loved it, and I really loved it. But it also brings to mind, day in and day out when I see young men, Black men, Hispanic men, men of color, going in and out of the men's health clinic. I really love it, because they really need the help. You'd be surprised the life-saving impact that this is having on the men in our community. And so continue to do that. And then also, but look at the clinic as a whole. Look at not only the clinic, but that whole building, where you have 32, 35 Black and brown nonprofits, individuals coming in there, thousands and thousands of individuals coming in that building on a monthly basis that's needing help. I would like to definitely encourage all of you to come out and take a tour and see what you all are supporting. So to come and take a tour and walk around and talk to all of the nonprofits and the agencies that's in the building, because you all are a part of the success there. And there's thousands of folks that are coming in, not just with the Harvest Foundation, but the Trauma Recovery Center. So I just want to say thank you for your support. Support the Black Men's Health Clinic, support that whole model, and thank you very much.
Thank you, Mr. Lofton. Jeff Jackson with Good Work Austin and the Green Cart.
Hi, my name is Jeff Jackson. I just wanted to say thanks for listening to everybody speak before your meeting tonight. The work that you guys do is really powerful and meaningful, and I'm grateful for it. I was here at the last meeting too. I'm with Good Work Austin, which is a group of restaurants that advocate for food workers here in Austin. And after I spoke last time, I went home and turned on the live stream to watch the rest of the meeting. And one of the things I was honored that you guys talked about what we're asking for. You spent some time thinking about it, and I just wanted to address kind of directly one of the objections I heard, which I think came from Dr. Martin, which is, why would we want to parse out some special interest group and give them any kind of special treatment whenever really the goal is how do we help people that are impoverished or poor. And I just want to take a minute and honor that concern. I think that's a fair and worthy objection. But I did want to offer a reframe as well. And the reframe is, instead of thinking like, oh, let's just help food workers, what we're really asking for as a group of restaurant owners is for you guys to pilot or do some sort of feasibility study that will actually bring a third stakeholder to the table with you. And I don't think any of the other programs that are going on sort of have something similar to that, where you could enroll the business owners or the employers in with you to try and solve this problem that the working poor face. I as a business owner, as someone who's in food, my primary concern are first my employees and then broader my community. But if you guys could figure out how to do this with us, and if you could solve for that template with this group of interested parties, maybe there's something new here that could work with employers on a broader scale across other industries too, and really make an impact for a huge chunk of the working poor here in Austin. So take that if you want it. That's my reframe. And thank you.
I want to thank you for coming. Thanks a lot. I appreciate your input. I really do. Thank you.
Yeah.
Thank you, Jeff. Up next, we have Joshua Hall Israel.
How y'all doing? Excuse me. I don't want to be too long-winded. I'm one of the youngest, so I'm gonna make mine quick. I believe in the Bible, and I see the problem in our communities stem from sin, and I'm not here to make this religious. And I've been here for a couple years now, maybe going on 2 or 3 in the Austin area, serving in the community. I do like community cleanups and stuff like that, and I see that like our problem is just sin. I will leave you guys to question me at your convenience, but it really pains me when I go like to a lot of the parks, because right now I'm houseless or homeless, you could say, and just to see the condition of our people, and then to hear it week in and week out, year after year. Our people are in a lot of pain, especially the homeless. So I just want to see you guys, and I'm here too to help really tackle that issue, because I think in one of the classes I was in today, my leadership was getting on me a little bit, and I really don't know how to address them, because I don't have the support I need in these type of areas, in boardrooms. This is my first boardroom speaking or meeting, and I just want to be a face for them, and then just somebody that people can lean on in times of need. So that's it.
Thank you for coming and speaking with us.
Thank you, Joshua. Up next, we have Sherry Beverlin with the Hungry Hill Foundation.
Hello, how are y'all doing? My name is Sherry, and I'm the Director of Resources at Hungry Hill Foundation. And I just can kind of piggyback on what Josh was just talking about just seeing the condition of our community and the individuals that are out there sleeping outside or in a car that's not meant for habitation. And with that, I want to say thank you to Central Health. And what you have been helping us do has been amazing, because we have been able to reach a lot more people. When you go out there just with sandwich or water for individuals and you see them, they need medical care. A lot of times they don't know they need medical care. They've been dealing with health crisis for years. They've been dealing with diabetes, heart conditions, cancer, whatever. And you can ask them, do you need to see a doctor? And they'll say, no, I'm good, right? but they actually have a life-threatening disease. So being able to work with Central Health has been amazing. We've been able to provide the wraparound services. So while we are talking to people about their health or MapCard, we can also feed them. We can also talk to them about mental health services. And just trying to, of course, we need more resources. We need more. There's a lot of people out there sleeping right now in the park where some other people are 50 feet away, playing on the other side and don't even notice them. And Dr. Lee and I talked about this recently. And it's so frustrating because I don't think people are doing it on purpose. I don't think they're ignoring the problem on purpose. It's just, if you're not out there, you don't see how bad it is, and it's a crisis. And so I feel like every organization in this room, Hungry Hill has a pretty good relationship with. We love Black Men's Health, we love community care, we love integral care. We've been able to do a lot of things with these people, but it's going to take a lot more work. And there's a lot more people out there that they don't have anywhere to sleep tonight, and they're thirsty. You know what I'm saying? You can pull up with food and they're thirsty, like simple things, right? But if we got to start somewhere, and if we want to get them into the clinics and get them the health care, get them into housing, get them the things that they need, then if we all come together, of course, it's going to take more resources, though. It's going to take more people. It's going to take the people that are the boots on the ground we need help, you know what I'm saying? We work holidays. We don't go to the doctor. So it's a lot of things out there that come up that we really do appreciate how much y'all have helped us so far. And we look forward to the future. Thank you.
Thank you, Sherry. Up next, we have Kermit Hyder with Hungry Hill Foundation.
Good evening, everyone. My name is Kermit Hyder. I serve as the Chief Operations Officer for Hungry Hill Foundation. We're a holistic workforce development program for unhoused residents. And leading with that, I just want to highlight and thank Central Health for our partnership because as our job to make people more employable, unhoused people, we highlight healthcare is the highest point, right? I can come with food, I can come with water. Again, it's going to take more than that. And for me to try to make a person more employable, get them ready to work a shift, they probably need medication, or maybe they can't work in these conditions, or the sun, or whatever the case may be. I just really want to thank Central Health and the Bridge Mobile Clinic for what they are able to do. The referral link for us to able to catch up with people, maybe they went to jail or something, to get them back on track, to get them back on their meds, right? They're able to come out at least twice a month right now to our resource center, the mobile clinic, and we host events where we go pick up individuals in the park that are experiencing homelessness, that let them know that we have Central Health on site right now. We have healthcare providers on site right now. And just knowing, again, this is going to take more. Our outreach, we're expanding. We want to thank everybody for what you are doing. But it's much more that can be done, and we can do it together. So I thank y'all for y'all time and everybody being here, but just knowing that this community, we have to do it together. So thank y'all again.
Thank you, Kermit. Up next, we have John Bautiste with Austin Transitional Center. And after John will be Sharonda Robinson.
Good evening. My name is John Batiste. I'm a case manager at Austin Transitional Center. After sitting, hearing everything that has taken place, I don't think it's where we start, it's not where we finish, it's how we continue. Right now, Austin Transitional Center has their own share issues, and we have our own share issues and concerns, but overall, we're trying to navigate those issues. Everyone in here is partners with one another some kind of way, and recently we have we're partnering with Black Men's Health Clinic. We serve probably about 300 men, and on a rotating basis, that come in as homeless, that don't necessarily have a home plan. And partnering with Black Men's Health Clinic will allow them, has allowed them to experience things they would not necessarily experience from mental health, from everything that Black Men's Health Clinic offer. And just like Dr. Wallace was saying, I've sat with Dr. Wallace, as well as sat with Brother Cameron Morgan, Ms. Dominique, as well as Mr. Keanis Williams, and thought about ways to help these men get back on their feet. and one person can't do it alone. And it's like I said again, it's not how it started, it's not how we finish, but it's how we continue the process. The process is hard, the process is lengthy. There are a lot of different methods that could take place, and obviously it's going to need funding. It's going to need funding, it's going to need the backing of the community and all the other, whether it's integral care, whether it's community care. But Black Men's Health Clinic is a prime place for these men of color to black, brown, green, yellow, whatever, they need help. And so I'm grateful for Dr. Wallace, Mr. Wallace, for what they do provide to the community. I'm a product of the religious community. And so even in that community, we still have our share of trauma. And because of the Black Men's Health Clinic, they've been able to establish partnerships within the church community that has also helped. But again, you still need the resources. So whatever it takes, hopefully and prayerfully everyone gets together to make things happen, not only for Black Men's Health Clinic, but for the city of Austin. Thank you.
Thank you, John. Up next, we have Sharonda Robinson with Black Leaders Collective.
Hello, good evening, Madam Chair, Dr. Lee, to the Board of Managers. I'm Sharonda Robinson. I serve as a community volunteer and as the CEO of the Black Leaders Collective, which is an organization that formed about 5 years ago to support leaders who were working in the community to move initiatives forward based on what was important to the Black community. So many of the folks that you have heard from here today that represent Black-led organizations participate and support the Black Leaders Collective. I'm here for two reasons. One is because you are voting on your values through your budget. And it is really important to us from the Black Leaders Collective standpoint that Dell and the hospital be more intentional about working with our community. We do not see them as active as we believe that they should be related to the Eastern Crescent and those initiatives specifically. And we would like support in bridging gaps. We would like support in holding accountability around what those requirements are contractually, and also the spirit of those requirements as it relates to changing health outcomes for Black and brown people in the Eastern Crescent and in our community. And so that was my first request of this body. My second is more personal. The last time I was up here was actually the first time I was up here, and it was in support of the Black Men's Health Clinic. And as a community volunteer and someone who has been active my entire adult life, sometimes you never know what life will bring you. And so I had a son who went off to the Army. And when he came back, he was badly bruised and broken. He experienced an accident involving the bomb, chemicals related to a bomb. And so he was retired early from the Army, and he came home to live with me to recover. And as the physical wounds recovered, as he healed from those, and some he's still healing from, it was the mental experience of that as a mother, we try to take that from our children. And he's an adult. You know, he's still my baby. This is the baby. It's always the baby. Why is it always the baby? You know, as an adult, I have to respect the fact that I can't go to doctor's visits with him, right? I can't direct his, the course of action that he takes around his own well-being. But I could pray, and I could ask for help, and I could ask for support.
30 seconds.
I need a few more. I didn't know. And and thank you. And so, fortunately, one of the places that I could call and encourage him to call, and I haven't shared this with you, was the Black Men's Health Clinic because of the support that you all gave. And I didn't expect that. That wasn't on my bingo card for myself or certainly for him. And he had gone to the VA and he had talked to doctors. He had been to the medical center in Houston. And I think all of those things led up to the success and helped to create a foundation. But the success happened when he talked with the folks at the Black Men's Health Clinic. It was then that he saw himself as a healthy Black man who had a future, a 23-year-old child who had a future and had something to give to this community. So I am personally, eternally grateful for your work, Dr. Wallace. We know we call you Dr. Wallace. And for the support of Central Health and believing in an idea that Black men's lives matter. And I'm grateful as a mother to be a beneficiary of that. My child is now in Korea, living his best life. He's been to Vietnam, he's traveling, he's exploring the world and doing things that I would hope for my child to be able to do. And hopefully he'll be back home soon. But in that time period, the last 2 years has been incredible trauma for our family. And to know that there are services available for well-educated, well-loved Black kids that were not available before, I am so grateful. And so please, I know that there are other families that experience these types of situations and different ones that need your continued support and increased support because of the state of our nation. And so I just want to say thank you. And thank you for the extra time. Thank you.
Thank you, Sharonda. Up next, we have Jacqueline Oviedo, who's joining us online.
Hi, my name is Jacqueline. I want to say thank you, Central Health, for your support thus far. Because of your investment, the Black Men Health Clinic has been able to not only serve men in our community, but also allow me to provide for my family and be a voice for the women like me. As a Hispanic woman, I have learned that when it comes to men's health, often you must reach them through the women in their lives. The families trust me because I look like them, because we share a language, and because they know I understand their struggles. When they send their husbands to the clinic, many of them come looking for me. With increased funding, we can continue reaching Black and brown men who too often feels unseen, misunderstood, and unheard. Ensuring things receive the care, dignity, and support they deserve. Thank you.
Thank you, Jacqueline. Up next, we have Cameron Morgan.
Hello, good evening, everyone. Thank you, Board Chair, Dr. Pat Lee, and the Board of Managers for your continued support of the work that we do at the Black Men's Health Clinic. And I must say that I am privileged to have the blessing and opportunity to serve as the Community Outreach and Engagement Manager for the Black Men's Health Clinic, or better yet, a broker of hope and trust for the community and population that we serve, and to be a part of really truly building the pipeline to the high quality and equitable care that's really working to create a sustainable safety net, not just a care plan, but a life plan for those that we have the opportunity to serve. And so, honestly and truly, with a population where trust has been broken historically, hope has been lost, it has been an opportunity for me to walk in my purpose in the role that I serve, and to come from a place of lived experience, as many other members of the Black Men's Health Clinic team have, to be able to really truly meet men and their families where they are, where they stand, and know what it looks like to be able to put the shoe on the other foot. I can share stories of men that are re-entering back into society that don't have a place to go, a phone number to call, or a phone to even use to call a person, even if they had someone that they may try to reach. I can share a story where a man has stumbled upon the clinic and had plans of committing suicide that same very day. But he was stumbled upon the clinic. He was able to connect with Ms. Dominique Street, aka Superwoman, that does an amazing job at what she does. And she was able to restore hope back into this man, to share resources, to educate him on, hey, there is opportunity, there is hope for you. And we're gonna hold your hand and we're gonna walk you through all of this. He returned a few weeks later and literally told us that he was ready to just, I'll give you all the stats, all the data. We can talk about no-show rates, cancellation rates, and all those things, but we are saving lives. And that's my claim to fame, to say that I'm a part of something like that. And so, everybody isn't as fortunate. And it's a blessing to be able to uplift those and give them a hand up. Some folks aren't looking for a handout. Some folks are just looking for a hand up. There are people that are living in their car, that are driving and showing up to work. They can't necessarily qualify for benefits and for help, but they just need a hand up. And being a part of Black Men's Health Clinic, we're able to do that. And I take pride in being a part of this every single day. I'm blessed to wake up and do the work that we do. And so thank you for your continued support. We need more. It's crucial. And we want to continue to meet men where they are, to be a part of providing and aligning with your strategic goals, your economic challenges, and your regulatory complexities in this economic and this political climate that we're in. And we just really, truly require more financial support as we further collaborate with you all and the other partners that serve this Central Texas community. Thank you.
Thank you, Cameron. And Christopher Rashad Sandals, who's a board member with the Black Men's Health Clinic, had to jump off, but he just wanted to give his continued support for the Black Men's Health Clinic and ask for central health support for healthcare coordination for our most vulnerable. Before I call on our next speaker who's joining us in person, did I miss anybody else online? I think we got everybody. Okay, perfect. Up next, we have Amit Matwani.
Yesenia, what was Jacqueline's last name?
We have Jacqueline Oviedo.
Thank you. Yesenia, do we have more speakers?
Just Ms. Manager Matwani.
Hello, I received a couple of emails with notes from folks who weren't able to be in attendance today, so I just wanted to convey those. One is in favor of a funded initiative of ours, and another is less in favor of our funding initiative. So I'll begin with the first one from Mayor Dr. Christopher Harvey of Manor. Mayor of Manor, Dr. Christopher Harvey. I can't be in attendance tonight, but I do want to acknowledge my support for the Black Men's Health Clinic. Please fund their efforts. In fact, would love it if you could provide additional funding beyond that request so there can be 1 to 2 full-time staff working to help us build a healthier community in Manor. We all know the importance of preventive care, and as we continue to recruit more medical service providers to our region, I believe entities like the Black Men's Health Clinic are well-versed in days collection and disaggregation, have superior methodology for connecting residents with needed health services, and would really be instrumental in building monthly prevention and wellness campaigns and activities. In all, please record my support for their continued funding and an increase in funding as funds allow. Thank you for hearing the needs of our community. The second is from another elected official from Lago Vista, Council Member Shane Somm. Wrote a much longer letter, so I did my best to paraphrase it. I feel like I do honor the intent. And Council Member Somm's letter to the board, as it was addressed, and Travis County officials, opposes the 2026 tax rate increase. Councilmember Somm argued that Central Health should focus on managing existing debt before burdening taxpayers with higher rates. Those are roughly his language. Suggest that communities on the outskirts of Travis County, like Lago Vista, don't receive proportional benefits from the funding. And also disagrees with the board and appointment structure, suggesting that it's heavily influenced by Austin interest, leaving no voice for outlying communities. He did invite the board to meet with Lago Vista residents to understand their needs and urges them to reject the tax increase, prioritize debt reduction, efficiency, and equitable service across the entire county. Again, I was communicating from others who wrote to me. I felt it's my duty to be able to convey those messages. Now, utilizing the remainder of the time, I think everybody in this room knows that I am a big supporter of, in addition to so much of the clinical and much needed clinical expansion, obviously, of our health equity plan, a supporter of the ancillary and supporting services that we provide in as much as coverage for folks in the HAM program, my support for the potential coverage and work with the food service industry and food workers, my support for the Black Men's Health Clinic, obviously. And I'd also like to express gratitude to Trish, who has come to express that Integral Care is indeed working to address some of the wage concerns of the frontline staff at the LMHA. I was at that board meeting last week, last week, and it was a very difficult situation, and you can see the pain on the faces of everyone involved, because the resources are so limited, and I was moved to see the board members working so hard. Unsurprisingly, of course, our board chair, Ann Kitchen, was there as well, working so hard to meet the concerns of the staff. I always think we can go further when it comes to frontline workers, but I'm deeply appreciative of the difficult choices that need to be made. Thank you.
And that concludes this evening's public hearing.
Thank you. Okay, thank you, members. We've now received all of our public comment for our public hearing. Before we move on to the next item, I wanted to check and see. I think our staff had more they wanted to share with us related to the first item. So I'll call on Jeff Knodel. And let me just say, while they're getting set up, as a board, we really, really appreciate everyone who comes here and speaks with us. It helps us understand what people are going through. And it also, we know it's not easy. And we really, really appreciate everyone coming and talking with us. Go ahead. Go ahead, Manager Jones.
I'd just like to acknowledge the work of the Central Health outreach team. A couple of Sundays ago, they were at David Chapel doing screenings along with the NAACP and the Black Leadership Collective for individuals in the African American community. And I want to acknowledge the work. There's a lot of work that's being done. Central Health is engaged in it. We need to continue to support it. But I did want to acknowledge Ted, your team. Sella, I don't know if Sella is still here now. She did a fantastic job in that. But I want to acknowledge them doing that.
Thank you, Manager Jones. Jeff?
Yeah, thank you. I'll be brief. So we just passed out the presentation. I think the first few slides are the open presentation that we had at the beginning. If you'll turn to the page that just says Central Health FY26 proposed budget. I just want to go through a couple of just technicalities related to our budget. Two things. One is just a reminder related to the Travis County financial order, a technicality that we'll need to comply with. And then secondly, we've been talking about the establishment of a new financial reserve policy related around our public health center. So I have drafted up some proposed language. Next week, we will propose recommending approval of that financial policy. So wanted the Central Health Board of Managers to see.
Yeah, sorry, Jeff.
Sorry, my allergies have elected to try to kill me here. So thank you. I will try to talk louder. So with that said, I'm going to launch into a couple of these. Just a reminder, next week on the Central Health proposed budget, we are proposing recommending approval of both the Central Health and the Community Care FY26 budget. So next slide, please. This is just the actual excerpt from the financial order that the Travis County Commissioners Court approved. Basically, in a nutshell, it requires that the district present a no new revenue budget along with our proposed budget. We're scheduled to go to the Commissioners Court, not next week, but the next week on the 16th. Next slide, please. So y'all will recognize this as attachment A. So this is a side-by-side comparison of our proposed budget on the left-hand side, and then the proposed no new revenue rate budget. The boxes in red are the changes from the proposed budget at a no new revenue rate. A couple of things change. One is the tax rate changes. So you notice it goes from 11.8023 cents to 10.7587 cents per $100 valuation. Our property taxes are decreased by about $33.4 million. And of course, this impacts our overall contingency reserves through that decrease in revenue by about $33.4 million.
Let him finish first, and then I'll call him first.
Next slide, please. So as I mentioned, the tax rate decreases. The impact to the average homestead decreases from our 8% over the no new revenue rate of $64 to, at the no new revenue rate, $10. So a difference of about $54 on the different tax rate. Next slide, please. And then, so what is the impact of the fiscal year 26 no new revenue rate as it relates to not only fiscal year 26, but also the impact as it relates to our 5-year forecast that we use to look at a longer term financial picture. So as I mentioned, for fiscal year 26, it would reduce our property tax revenue by a little over $33 million. Over a 5-year period, just looking at that 5-year period compounded at 8%, it's about $197 million over that time period. And then just some of the future impacts that it would occur related to a decrease that significant. And I won't read through all of them, but we can imagine it will force us to take a look at the services we provide, the depth of the services, and some of the implications to the our healthcare system related to longer wait times and more utilization of our emergency room. But last but not least would be, because of the magnitude of the decrease, it would give us a lot less financial flexibility and capacity to mitigate risks that seem to be occurring on a daily, weekly, monthly basis related to healthcare in our country, and in particular to the safety net. Next slide. And so this is our traditional look at our 5-year forecast. The solid lines, so we've been presented at our last meeting our 8% over the no new revenue rate reserve slide, along with a debt issuance. And so you'll see that in the blue and the gold line. And then the dotted lines are the no new revenue rate in fiscal year 2026. And as I noted, the impact over a 5-year period is significant. It reduces our days of reserve, which is our financial metric that we use, from a range of 106, 46 days to, in essence, a negative number, -7. So at that point, we have depleted our reserves. And so that's the long-term impact, with all things the same and not taking any measured steps to adjust accordingly. Next slide. So we've been talking about a new reserve policy related around our public center reserve. And so I've just listed out a couple of the objectives related around the establishment of the reserve. Initial funding of $12 million in Central Health. That mirrors the amount that's been established by the Community Care Board in Community Care for an aggregate of $24 million, which represents a minimum of 30 days of cash on hand. On an annual basis, we'll need to reevaluate the reserve amount to maintain a target of 30 days of cash on hand. And then any use of those funds would require a repayment plan that would need to be presented to the Central Health Board. So next slide is the draft language related around what I just spoke to. I don't think there's anything different on it other than the actual use of those funds would require a repayment plan to be presented to the Central Health Board within 45 days of such use. And so one of the questions might be, well, how did we pick this number? Community Care has a little different cash flow stream than Central Health. And one of the biggest concerns would be there's something unanticipated that would occur at Community Care that would require quick action. And so from a liquidity standpoint, we would want to establish enough of a reserve capacity so that we could develop a plan in order to remedy whatever the event was. And so we feel like 30 days is a sufficient time to develop a plan, use the reserves if needed, and develop a repayment plan related around those reserves. So that concludes my presentation. These are just technical budget items that we'll be bringing forward next week. I didn't want to come next week and ask for approval without the board seeing these items.
So just to recap, what you've provided to us is first the no new revenue, what the picture would look like,
Yes.
which is required of us to present that picture to the commissioners. So
Right.
that's the first thing. The second thing is a reserve policy you'll be asking us to approve next week. So members, it's 7:30. We have one more item to go through that'll take us at least 20 minutes and possibly 30 minutes. So I'm going to see if a few people, I'm going to ask if you have questions of Jeff right now. I'd ask you to keep them very short because we do, the next time's very important also for us to go through. So I know that manager, Dr. Musaitis had a question. Do you want to go real?
Thank you, Jeff. I have a couple questions for you. So when you're talking about the no new revenue tax rate, and this is the proposal of last year's tax rate, about 6%, correct? Is that correct, me? Oh. So
what's
the assumption for the revenue rate is 6%? Of what?
No, it is
I'm just, if you can clarify that.
Sorry, it is the actual no new revenue rate for fiscal year 2026.
Okay. So the other question, and I think this is something that we've had multiple conversation around in terms how many days cash on hand. And I know you have mentioned it and explained to us multiple times the need of 100 days cash on hand, correct? Isn't that the policy?
It is our financial metric that we try to marry up based on our bond rating is a range between 120 and 150 days. That's not in a financial policy, it's a financial metric that we try to maintain.
So what if we, for 1 year, decrease that for whatever, and for assumption that we don't issue the debt? So like, what would the implication be to Central Health? So if you don't have to answer, if you don't have the answer for me, but I would like an answer of that.
Yeah,
So let's not,
okay.
so you're making a request for another scenario. So maybe Jeff, you can work with Jeff on that.
Okay, yeah, I would like that scenario. Thank
Okay.
you.
Okay, any other questions? Again, let's keep them short, and there'll be more opportunity next week.
I just
Yes.
have a quick governance question. Jeff,
Yep.
the cash reserve policy for the Public Health Center, is the only role of the board to approve the $12 million? Or does the board also, is there a certain amount of money that comes back to the board for approval?
No,
If it's gonna be spent?
we're proposing a $12 million amount in Central Health. That's the action we would request.
No, but I mean from a governance perspective, so once we approve this policy, the administration has full approval to use that money and they don't have to come back to the board for any kind of approvals around that, the use of that money?
Just a repayment plan.
So you just have to give notice of the repayment plan?
Yes.
And that's it?
Right. It's a 45-day plan or ratification. So it'd be in the event of an unforeseen emergency, and I'd be happy to strengthen that language a little bit. My quick take on it would be something unanticipated regulatorily or electronic health record related that could paralyze a system and require immediate action.
Thank you.
Okay, other questions? Go ahead.
Just, Jeff, since this is so different from what we've had, you presented to us the last couple of meetings, correct?
I'm sorry, I didn't see
So this new, no new revenue recommendation.
It's not a recommendation.
It's a requirement that
That has to be presented to us.
that has to be presented to
Right.
the county commissioners.
Yeah, the county's required this, think of it as another scenario that the county's required.
I get it.
Okay.
And with respect to that, I guess what I was looking at is whether or not your staff has allocated the amounts of money that would go to the various proposals that we're looking at funding under what we have been talking about, not this one. So that what we would have here would have matched this one. And what do we have that looks like this that's reflective of the no new rate? Do we have that? I'm just asking if we have that, so that it gives us, as a board, an opportunity to look at what kinds of dollars we're looking at allocated for programs and projects for Central Health to fund.
Could could I ask it another way? So, did you change, for the no new revenue, are the expenses the same? It's the same.
That's what I was gonna say. They're exactly the same. The
Okay.
only
Okay.
difference is
We're just
property
paying for it
tax
out of
revenue
reserves.
Got it.
and reserve levels.
Thank you very much.
Okay. Any other questions? Okay.
Yeah, just a comment. I think this may address the question, but it'd be helpful to have at next week the enhanced program activities that we're going to be doing in the various areas. This might be what this is supposed to be, but I want to make sure I'm understanding that correct.
Yeah, and that, sorry, I didn't realize that. I should have mentioned that also. So traditionally, we've always provided a list of providers that we plan on utilizing. And so we're presenting that list to the board in the event there are any conflicts or any recusals that the board elects to make in adopting the proposed budget. So that's the purpose of that list. But we can, if you
But it's
want to
also-
restate your request, we'll try to comply with it next week.
Okay, but it also lets us know what new programs, what enhanced programs, many of which we've talked about tonight, are gonna be part of this, are gonna be part of it. Okay, I just wanna make sure.
Yeah.
Another way, it's a follow-up to that, exactly.
Yeah, and I was gonna give an explanation, but
Jeff, what I'm looking at is, since we have this list with the totals, I was wondering if we could have an itemized list for amounts of, program, allocations of dollars.
We typically don't list provider amounts because we're negotiating with providers. So what that amount represents is the budget in that area.
well, I think that I think that what, if I'm hearing you correctly, what you're asking for is understanding that it's the proposed amount. You still have to negotiate, right?
My concern is that I'd like to know what each of these amounts is itemized, because if there is an amount of money here, let's say that the pilot or Shannon's or the Black Man's Health Clinic and all the others, and then our HAM or whatever, if there's a different amount, because it's all lumped together, I don't see it itemized out, then what we're expecting to see, I'd like for us to know that before we vote.
Okay.
That's what I'm saying.
Okay, and I also want to explain that we had some conversation earlier today about what we'll receive next week, and I know our staff's still working on it, but the conversation was that we will be voting next week, so we need to be able to point to the document that we're going to vote on, and that document has sufficient detail in it so that we know what we're voting on. In years past, we've voted on a resolution that has always said, we hereby vote on the budget, which consists of, attachment A, attachment B, attachment C. So I know the staff's still working on the actual document, but we will have a document that you'll be asked to vote on, that you can tell what you're voting on. I think that's a bottom line necessity, and I'm hearing some level of detail that different people are asking for, so I'm asking staff to hear what they're saying. That's the kind of detail that we need to see.
I think that this year, Madam Chair, is such an extraordinary year that we need to know that to advocate for the people we're here representing, the entities that we're here representing, and the residents that we're representing in Travis County, to be able to fairly vote. And
Okay,
we're just in
so
an
I'm
extraordinary
gonna
time.
move us on unless, did you want to add anything?
I just want to second her
Okay.
comments,
And
please.
third it.
And third it, so
Yes.
you're hearing the level, for it, you're hearing the level of detail that people are requesting in order to be able to vote, so. Okay, all right, I'm gonna move us on now to the last item that we have, which is an informational item, to receive and discuss a presentation on the integrated ambulatory system of care. Dr. Lee and Dr. Yagoda will be presenting, and to keep our energy up, I'll be passing around something I brought back from Santa Fe. Oh, thank you. All right, first off, before we move into that, we need a motion to close the public hearing, a motion from Manager Valadez, a second from Dr. Musaitis. All in favor?
Aye.
Okay, now we'll move on. They're chocolates. Huh? It depends on how many questions. They're gonna present it and talk about it. Okay, where are our presenters?
Chair, one more thing, Chair Kitchen, in your speech, you're supposed to announce when you're going to take the vote on the tax rate. That's actually statutory.
Thank you. Okay. I also need to announce that we'll be voting on the proposed tax rate at the Board of Managers meeting next Wednesday, September 10th, which is posted for 3:30 p.m. at the Central Health Admin Offices, 1111 East Cesar Chavez. Okay, now, where did our presenters go? Okay. All right, I'm gonna pass it this way first. Pass it around, and then, or should I pass it this way?
This way.
Don't take too much, or this side of the table's gonna be mad.
Understood.
Yeah, I think you can go, you guys can get started. Why don't y'all go ahead and get started?
Good evening, managers. I'm honored and delighted to present together with Dr. Yagoda content, a set of slides that we had the privilege of sharing with the Community Care Board last week. And in consultation with Chair Kitchen and Vice Chair Benson, we've opted to present exactly the same content to our board. So my role is really to provide some initial remarks to tee up Dr. Yagoda. So we have further opportunities to dive deeper into system overview as a board in the subsequent meetings. So my remarks are fairly brief for tonight. Next slide, please. The place we want to begin is just to acknowledge that we are in Travis County. And for over 100 years, there have been substantial and structural disparities that have added up to the present day fact that the life expectancy east and west of I-35 is 10 to 20 years different depending on which neighborhoods are being compared, and that the cost of those health disparities can be measured in economic impact, the medical expense that could have been avoided if someone had a devastating stroke, for example, the economic productivity that could have been maintained had they not had that stroke, and the cost of an earlier death if that individual died 10 years before their expected time, valuing that year of life at $50,000 per life year, a methodology that was developed in the Economic Impact of Health Disparities in Texas report that the board is aware of. And so the total cost of those health disparities goes far beyond the medical dollar, goes far beyond what insurance company necessarily is at risk for. It is the cost of doing nothing that the public ultimately bears. At least $1.1 billion per year. I say at least because the methodology of that report I'm referencing only looks at the individual case. And if Dr. Yagoda or I had a devastating stroke, more people would be affected than simply us. So we think that is the low-end estimate of the problem. And why does that matter? Because in our community and in our country, we have treated healthcare as a commodity and not a right. We have chosen to reward parts of the healthcare journey and not pay for others entirely. And we have a system in which this is a huge industry, and a lot of wealth is made and extracted from the parts of the system that make money, and very little is done for the rest. If we want a different outcome than what this system is designed to do, we need to fully embrace our role here in Travis County. We were created by taxpayers to address the deep root causes of health disparities and health equity. and to do so in a generational context to solve the problem of decades, several decades, many decades long, many billions of dollars of investment needed with no expectation of financial return to the investor. Something that no private entity, no nonprofit is ever going to have the business model to take on, but we are designed to do just that. Next slide, please. This is a set of images the board has seen before, but I'll just make the point that those little gaps in the convoluted care on the left-hand side, those gaps hurt people and those gaps kill people. We heard some of that testimony earlier today in the public comment. And what we envision for a diagnosis of deep fragmentation stemming from the way that we have approached healthcare as a country is a fully integrated system here in Travis County, end-to-end, birth to death, the most upstream, proactive, preventive care to the most downstream, quaternary, specialized care, to the recovery on the downslope, behavioral health, dental services, and the full range of social non-medical needs, including belonging and meeting people where they are in all the ways that are needed in our community, both within our system and with our many partners because of our deep capability and special sauce of being able to work with so many partners in a one-track, many branches fashion. That we believe is the necessary solution to the life expectancy gap and the billion-dollar cost per year of doing nothing. Next slide, please. And so this is my last slide. We are Central Health Community Care in Sendero. We provide the ability to approach universal coverage for our community here in Central Texas, centered in Travis County, through a combination of Medicaid, Medicare, third party, Sendero, and as the payer of last resort, MAP Basic, and other programs that we run together. That is a fairly unusual system. We are locally controlled. We can come together on the table. We have multiple times with the leadership of these three orgs and the boards, and we can pivot and respond to local conditions, and we can integrate that with the care system in which we have a tremendous primary care medical home backbone we're extremely proud of, one of the largest in Texas, one of the largest in the country, and it characterizes the strongest aspect, I think, of our care system, and is the strongest system to build upon, an extremely innovative and mission-oriented health plan that does things that few health plans do because they're part of our system and oriented to that mission. And together, we make this statement that we believe there's no other entity in Central Texas that is better positioned than we are to make the changes needed in a generational context to truly solve for health equity at its root. And so with that, it's my privilege to hand over to Dr. Yagoda.
Thanks, Pat. And thank you to the board for welcoming me back to have this conversation. I know there has been a lot of interest in what does it mean to have an integrated ambulatory practice now, given the ever evolving and more deeply integrated system that we are, Sendero Community Care and Central Health. I'm just at the very beginning of that journey of understanding what this can be and learning a great deal from peers on the executive team at Central Health. And so what I wanted to present were at least some anchoring points that I think form the basis for any build out of an ambulatory strategy over time. And so if we could go to the next slide, I'm going to just focus on three main points. When building any sort of strategy, it's key to understand what differentiates us from others in the field, either locally, who may be considered competitors or comparators, or even extend that more broadly. We are doing both because as a public center, we're rather unusual in the landscape of community health centers across the country, and also in the landscape of ambulatory practices for public health systems, public hospital districts here. And there are three principal differentiators that are going to put us in an extraordinary advantage towards achieving what is a ambitious and transformational aspiration for the central health system. The first, and Dr. Lee alluded to this, is that we are a full payer provider system that actually exists at the local level. We have end-to-end control in theory, and certainly evolving more and more in real time every day, of what that total cost is, whether that cost is the cost of health services directly provided, or whether that is the cost of, to what Dr. Lee has said, the absence of services, the absence of doing anything different from where we are right now. And where I did my training in Massachusetts, I grew up in New York, both Medicaid expansion states have many advantages to what Texas offers generally from its Medicaid expansion. But even at that level, the ability of health centers to innovate in such close proximity with a payer was far different than what we have. We would have had to negotiate with a state Medicaid agency, and the level of bureaucracy is just much, much different. Here, we sit around the same table deciding what are the most important issues every single week. That is very, very different. We've already seen our ability to be able to respond in real time to challenges that would not be possible in even the more advantaged states. Number two, this is a relatively young hospital district, and because of that, we have neither a hospital yet built or yet owned within the system, and certainly don't have the burden of legacy health systems that were historically built around feeding hospitals that we now recognize are less favorable from an outcomes perspective and less favorable from a financing perspective. And you have all watched as over the last decades, as CMS is shifting and many other health systems are shifting to more of an ambulatory focus, they're doing so carrying much of that legacy burden of hospital-centric financing and patient navigation systems, so that seamless patient experience, it is all grounded on ensuring the viability of those hospitals. We get to start from scratch and get to build with what we know generates better outcomes with more value, which is an ambulatory basis for the system that must include hospital access for sure, but need not be the foundation of the system. And then the third is our dual accountability. We are accountable within the FQHC space to our patients, which is an incredibly powerful leverage point and allows us a level of insight and intuition that is not common to most other health centers. And we are directly accountable to the taxpayers who give us a level of support that is very, very fundamentally very different from any other health system, even the nonprofit health systems. And both of those together allow us a transparency, a building of trust, and frankly, a leverage that most other health systems will not be able to compare themselves favorably to. So looking at those three differentiators, the things that make us different from any other hospital district in Texas, from any other large system around the country, at least that I know of, and I would welcome any sort of information about other systems that may be in such a comparatively favorable position. It is my belief that we have to take this moment, particularly as this health system rapidly evolves in the coming years, to establish this foundation of a strong ambulatory footprint that will serve as the basis for all the other feeds to lead us to the equitable outcomes that Dr. Lee referred to at the beginning. So this is just the very beginning, but in point of fact, it is in some ways that center of gravity for how we build out the rest of our ambulatory strategy. anticipating doing that in a collaborative fashion with our peers here from the Central Health Executive Team, certainly with the input of Community Care's senior leadership team and board. That will evolve over time, but this clarity of what sets us apart from all others is the most important first step to building out the future that Dr. Lee referred to.
Thank you. I am going to ask two quick questions, and then I'm going to go around the room. So the first question, I'll tell you both questions, and you can answer them however you choose. And so we have the opportunity of working with you as both as the CEO of Community Care and as the Executive Vice President for ambulatory care across the system for Central Health.
Yes.
So my first question would just be, describe for us how you see your role. That would be one thing. And then the second thing, how you see your role in building this integrated ambulatory care system. And then the second question is, what do you see as some of the biggest challenges?
Great questions. If I can start with the one, the second part of what I believe was the first question, which was, what does this look like? We have spent the last couple of months amongst the executive team trying to understand what are our roles in complementarity to one another. And this has been a very intentional and delicate process to ensure that everyone understands what great value we are bringing to the organization, to the system, and two, how we can complement each other best in order to lift up the broad amount of really substantial amount of work that lies before us. We're just in the final stages of getting that complementarity and high-level definitions of what our roles and responsibilities are. Largely what that means for the EVP of ambulatory services is overseeing ambulatory services, and that is the operations, the strategy, et cetera. But all of this is intimately linked with what our standards of practice are across all aspects of the health system, whether it's ambulatory, hospital, health plans, et cetera. Similarly, around the finance or operations, there's that interwoven aspect to ensure that the direction and the resource that are being supplied by the system are integrating with our day-to-day work. So overseeing basic ambulatory practice. That is both the health center work and those aspects of clinical practice that lie outside the health center. We will, as this system matures, have to have very thoughtful discussion about what should lie within and what should lie outside of the health center program. We will be very transparent about what are the driving forces for those, but ultimately is to be able to oversee those that lie within and outside of the health center project. So, and can you repeat the last question that you had?
Second question was, what do you see
barriers.
as the greatest operational challenges?
There will be, if we build the common sense of purpose using standards across the Central Health and Community Care ambulatory practices, we will eventually practice in a way that it almost is not apparent to the patient or even staff members in which system you sit. The alignment of those standards is more simply said than done. And so we will be looking for best practices from both spaces and combining those into one common standard such that it's not apparent except to those who lie behind the scenes, really what environment you are sitting in, if that makes sense.
Okay. Okay, I'm going to start around. Oh,
Did you want me to answer? And could I answer the second question as well, if I may?
Sure.
I agree with everything that Dr. Good has said, and I would add, I think our greatest challenge is going to be change management.
Okay.
what I mean by that is acknowledging the urgency to change that we feel, and also listening carefully and responding to readiness for change in different areas and being flexible about that. My colleague Kim Heinen distinguishes between what he calls natural change and forced change. Natural change is sort of the sense of pull. We're ready. It just makes sense. It's time for us to move these things even closer together, sit together, etc. And forced change, as you can imagine, is making it so before folks are ready. So, how do we sense, encourage, and then follow natural change while maintaining a sense of urgency and a sense of closeness, proximity, empathy, and continuous communication to allow us to do that as a team. But the reasons for doing this, the opportunities of doing this, the essential strategic importance of doing this, I think we are entirely aligned around, which is why I'm very confident in this ultimate outcome, but we need to navigate the change journey thoughtfully.
Okay, thank you, Dr. Lee. I'll start on this side. Manager Rodriguez, do you have any questions?
I don't know that I have a question. I mean, I think, again, I'll speak for myself. I have an urgent patiency for the transformation of healthcare that provides quality care for the poor and the vulnerable in this community. I also want to make sure, and Dr. Uguna, I just wanted to make sure, and your reframing of Central Health, I just wanted to add that this Central Health started because it owned 2 hospitals. Not only did it own Brackenridge, but also the Children's Hospital of Austin. So I think it's important to understand the name hospital district, and it has that. And as you mentioned, the vision and the opportunity, you don't own one right now, which is great, but I think it's also important, and I guess I'm too old to know that it started because of that foundation. And now the transformation of care is really, who cares where the health services are provided? It's about improving the quality of care. And so to the extent that this board, in terms of its governance, can help support, accelerate all that, I think we're all in, and can't wait till the next iteration of this, which is more about strategy, goals, tactics, implementation of ambulatory care to improve quality care. So I'm sorry, there was not a question in there, but there is a clarification about kind of what we need in our community and why.
And I heard you ask for the next iteration once you guys get further along.
Certainly.
So if you want to repeat that. Was strategy, goals?
Oh, I'm sorry. Sorry, I was on autopilot there for a second, I guess. Strategy, goals, tactics, and implementation. Because the implementation, I know squarely, is the VP of Ambulatory Services. That's who we're going to hold accountable and responsible for implementing the tactics. And the board is going to agree on the goals mutually with administration. And the strategy is going to be what the board supports from a governance perspective.
So that's an invitation to come back to us with that additional detail when you're ready.
Yeah.
Okay, Manager Valdez?
Again, not really a question, just an affirmation. I am very happy that you all are working together so interconnectedly, because one of the things that I have asked, well, I hoped for a long time, is to see the development of protocols and efficiencies in the provision of services to our patients so that we lower the cost of the provision of those services, but we increase the quality of healthcare received by the patient. And that, to me, I think is something that we're still hoping to achieve. I would have liked to have seen more of that proven to me through the various DSRIP projects. I didn't quite see that. And I'm very thankful that you all are aligned and working towards the same vision for our Travis County residents. That's all. Thank you.
Thank you. Dr. Martin?
I have a comment. I'm really happy, as Dr. Manager Valdez says, about y'all's working so well together. I'm really happy to see the focus on ambulatory care. I think as physicians, we all know that any admission to the hospital is kind of a failure of medicine. That anyone's up on the cath table is not good. That was taken the wrong way. And I think that focusing on that, where the hospital is kind of the black hole, and we keep them out of the cath lab, I think that's great. So I'm super happy to hear you guys working together.
Thank you. Dr. Musaitis?
Well, thank you so much. Appreciate it. What stood out to me, your first bullet, you're striving for true health equity, which is phenomenal. But I'm also thinking about the system. You have partners. And what is the integration of the partners to achieve that health equity? Are they in alignment? And I say, we have that dual accountability for our patients and our taxpayers. But if our partners are not aligned with us, how can we achieve that true health equity that we are striving for and we are accountable for as well? So I know, so it is very complicated, but I'm just wondering in terms of central health and community cares, we're building the system. But this system also has our partners, our outliers, who we need them to be true partners in this.
I'll take a swing at this. First off, you're right, this is focused more on internal to the system. In large part because we build that foundation, it'll be much more compelling for our partnerships to become perhaps more favorable and more integrated. As we are able to build a level of seamlessness for our patients, able to anticipate with greater clarity what their needs are, we're going to be able to be more precise with the needs that we have for partnerships. And actually, it may reduce dependencies that we've had historically. It may actually expand other opportunities to reshape how those partnerships exist. So we'd have to talk probably on an individual basis for each of those partnerships, but the stronger that we are able to build this foundation, the more compelling it will be for folks to partner with us in more favorable terms, certainly.
And if I could just build, Dr. Satif, you're absolutely right. For the scope of the problem that we want to address and knowing where our core competencies lie, we cannot get from here to there alone. And so our recognition of the importance of one trunk, many branches, our ability to build relationships, to build and rebuild trust, but also to do all of the work of contracting effectively. You heard from a lot of our partners this sheet that has, I didn't count them, but I understand from John Morgan, I might have this number not exactly right, but well north of 100, potentially 125 or north, partners just in the healthcare delivery space that we work with. And coming from different health systems in New York and Massachusetts, I can share that is very unusual to have that many partners. And that is a special sauce that we have. That's a core competency that we built in the many years when we were really planning and paying for care. And we're going to keep that competency alive and well. And so that allows us to work with the Black Men's Health Clinic, to work with Hungry Hill Foundation, to work with Sobering Center and so many others, meet people where they are, with communities and folks with lived experience and trust that they've earned over years in the community. And we are going to build a system unlike any other, not only ambulatory centered, but a whole village of aligned partners, small and large. And I understand there are very important large partners that we need to align with as well. And we've been having those discussions as well with the board.
And that is really primarily what I'm really leaning toward are ones who we fund exceptionally. What are they doing for our patient population that we need to address these health inequities? So thank you.
Manager Montwan?
Thank you. No questions.
Manager Jones?
Thanks very much. I just have a question in terms of growth. As we have all of these players in the circle, the growth that we anticipate, are we able to we're seeing where we're going to be headed. Because when the district was originally created, that was one vision. Here we are 20 years later, and we're doing something different, which is fine. And I commend the relationship that has grown together, because it's been very tenuous and very difficult. So I commend the staff in doing that. But as we go forth to do that, can we have that synergy of purpose for our patients and our community? But also, as the demographics and the epidemiology of this area changes rapidly, will we be able to incorporate other partners as well? We talked about the FQHC that we originally had. There are other FQHCs in this community. Is there the possibility, or should there be the possibility of looking at collaborating with them? Or those perhaps outside of the county, which creates other problems from a governmental point of view. But those are the kinds of things I just think that we need to have a planning strategy to look at as we move along the circle. But I commend you on the work that's been done, and look forward to the district growing even faster and better.
Thank you. I hear the allusion to strategy, and certainly what we imagine as a future today, 5-10 years from now, will have to be modified to the circumstances of the moment. So it's always a live document, so to speak, what a strategy is. But all the points you made are squarely in bounds for our strategic planning.
And Manager Jones, I invite Chair Kitchen to build on this certainly, but I think over the next few weeks, there will be a series of deep conversations with our board that should help paint in some of the perspective on that future strategy. This is the first of several that Chair Kitchen has helped us sequence carefully. You're absolutely right. We need to see the 5, 10, 20-year vision.
Thank you. First of all, Dr. Lee, let me commend you for your leadership on this. I love this. I love what I'm seeing, and it seems to make a whole lot of sense, particularly in terms of where we are today. So with that, I want you to know just how respectful I am of the work that's been done. I just have one question. At what point, and perhaps maybe it's already happening, perhaps it's ongoing, but at what point will this plan, as you're moving forward, this integrated system, at what point will you be integrating the community care board with respect to this? Or at what point will they be getting this information? Will you be communicating it?
So the Community Care Board has already seen what you shared. In fact, Dr. Lee and I were, was it last week, sat before the Community Care Board and went over the exact same presentation, got feedback. Also, I can share, equally optimistic and encouraged by where things are going. We intend to stay in lockstep with one another. And this was to Chair Kitchen's question before, what could be the barriers? Well, one of the biggest barriers is that we're not aligned as all the necessary components, whether it's the county, whether it's Central Health Board, whether it's Community Cares Board. There needs to be very tight in alignment. The dual accountability is an incredible strength. It requires a great deal of orchestration to make sure that we don't fall out of sync with one another. So we are right there with you, Manager May, that alignment must be tight as we work our way forward through this strategy.
Great, thank you. I was hoping to hear that. Thank you.
Thank you, Manager May, for your vote of confidence. I appreciate it.
Part of implementation science, the first thing that you have to identify is your barriers and facilitators, which is primarily qualitative study. So have you identified what are the barriers to this integrated healthcare system and the facilitators as well? And that will help you wind down and build off your strategy moving forward. Just curious to know.
On deck, it is part of the planned strategy development. We just haven't. I think we could all pull out of our pockets a number of ones that are very obvious to us, but we will, as we work through the formal strategy preparation, all of that will be considered.
Okay, managers, I'm going to move us on. It's 8:15. Thank you, Dr. Lee, and thank you, Dr. Yagoda.
Thanks very much.
We appreciate. the conversations. We'll look forward to future conversations as you all develop this system and develop more detail for us. So thank you. Okay, managers, we have one last item, and that's the consent agenda. I'm looking for a motion to approve the consent agenda, which is only the minutes from our meeting last week. So let's see, Manager Motwani moves that we approve the minutes. Second, Manager Valadez, all in favor?
Aye.
Okay, let's see, let's see. The last item is to confirm the next regular board meeting date, time, and location, which, as you all know, is next week, September 10th. And we'll be voting on the budget at that time. And if anybody wants chocolate that didn't get anybody, come get chocolate. Okay, all right. Motion to adjourn from Manager Valadez, second Dr. Brinson, all in favor? Aye. Okay, thank you.